as I've been saying you, this is very, 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 very important. And there is no paper, whether it's in AIMS or in NEET, there has been a paper where there is no question on pediatric traumatology and endodontics. There is no single paper there. And even further, if I tell you, there is no single paper where they have not asked a question on Ellis fracture. Every question paper in the last 2 to 3 years, there are questions on Ellis fracture. So it's very, very, very important. Now, before I start going into the, now, as you know, the most important part of the traumatology is your management. Okay, management of fractures. So before I go into the management of fractures, I want to give you some terminologies. Okay, you have to understand certain terminologies, like now very familiar ones like complicated and uncomplicated fracture. So there is a term called uncomplicated fracture and there is a term called complicated. Now, what is uncomplicated? Uncomplicated, what is the biggest complication we have in dentistry when it comes to teeth? It's pulp exposure. So it's complicated when there is pulp involved, and when there is no pulp involved, there is only enamel and dentine involvement, you call it as uncomplicated. It is so simple. Okay, so if you just see this in this cluster, we'll come to this, which is basically the complicated, and 1 and 2 are uncomplicated. Okay, crown fractures, we'll come to that. Now, more important terminology is crown root fracture and root fracture. Again, this is very important for you to understand. So if you just consider, okay, I'm very bad in drawings, okay? So if you just consider this as a tooth, okay? And if the crown is involved as well as the root is involved. So if a fracture line goes like this, okay? It is involving the crown and root, isn't it? It is involving the crown and root. Now, instead, if a fracture line goes simply somewhere here or here, it is only root. So there is a difference between crown root and root fracture. Okay. Now, as understood, as you can, it's very clear, the crown root fracture will involve a part of enamel as well, plus dentition and cementum. Okay, cementum of the root. Now, if here there is no enamel involvement, that's one major difference. One. Okay. Second thing is, as you all know, there is a pulp inside your, tooth. Just imagine this is the pulp tissue. Okay, the crown root fracture can involve the pulp or cannot involve the pulp. Both the possibilities are there. I'll show you how it is. Imagine you have your, I'll just make it bigger. So if the fracture line goes a very thin way like this, okay, it doesn't involve the pulp. Or I would say it should be on the other side if it goes, okay, or it goes like this, okay. If it goes like this, okay, or even more closer because I've drawn the pulp very close. If it goes like this, it doesn't involve pulp, isn't it? Whereas it goes even deeper, it involves pulp. Now, this will dictate the management, understandably, isn't it? It will dictate the management. So this is what is crown root fracture and root fracture. So both of them have got a different management because you have got a structure here which is fractured and you have to decide should you remove it or not. And if you remove it, what is the status of the pulp? Okay, so the pulpal involvement is there. Whereas in root fracture, definitely always there is a pulpal involvement. Okay, always there is a pulpal involvement. Okay, now that's our crown root and root fracture. Now, so far we saw the major involvement was associated with your pulp, enamel, dentin. Okay, now we're coming on to luxation injuries, or you can call it as injuries which involve your periodontal ligament. Okay, little small. The injuries involving your periodontal ligament. But that is very, very, very important to understand. The certain terminologies like concussion, subluxation. I'll come to the clinical features. I'll show you pictures, but this is just an introduction on understanding what the major difference, major difference is all about. Okay. Now, so basically, both of them, concussion and subluxation, both of them are involving your periodontal ligament. Okay, and there is luxation injury, that is the tooth all of a sudden hits and it moves slightly. Okay, now the major difference which you have to understand in concussion, okay, please note, in concussion, there is only tenderness. Please note this. Okay, only tenderness is seen. Okay, now when it comes to subluxation, we are going to come to luxation very soon. When it comes to subluxation, there you're going to see, okay, clinically, okay, when you see as such the patient, the teeth, there's just a teeth which is there. Okay, maybe you'll see bleeding from the sulcus. I'll show you the image, but then you can't differentiate by simply looking into it. So the subluxation, there will be tenderness. So there is tenderness. Okay, there is tenderness plus mobility. The tooth is mobile. Okay, the tooth is mobile. This is a major difference. So now you'll ask me, what about luxation then? Okay, because you say that the tooth is mobile. Okay, whereas in luxation, the tooth is moved, displaced. So when you come to the next terminology, which is luxation, okay, what you see here is not just mobility, it is displaced. Very important to understand this. Mobility is like it is moving. You move it to it come back. Okay, you know how mobility is. Whereas luxation is it's already moved from its original position to another position. The tooth is moved. That's called displaced. Okay, there are different types of luxations like extrusive, intrusive. Extrusive means going out, intrusive means in like inside moving inside the tooth. Okay, it hit, and I'm talking about the mandibular tooth is went inside, so it go out. That is called intrusive, extrusive. Then you have got lateral, where the tooth moves mesially or distally. Moves in the sense displaced mesially, displaced distally, lingually, labially. So all these are displaced teeth, luxation injuries. We'll come to more details of this. And finally, you've got avulsion. The tooth is just out of the socket. Very much related. Okay, so that is, hope you understood the terminologies, all of you. If there is any confusion, do let me know. Hope all of you understood the terminologies here. Very important to understand these terminologies before you understand the management. Okay, and clinical features also very important. So today I'll be giving a kind of, intro lecture, because if I directly go into the management part, it is really confusing. And one thing I've made easy for you is if you open your textbook, if you read your textbook, you'll see that you have got one entire details of concussion, one entire details of extrusive luxation and intrusive luxation. So what happens by that methodology, it's very good to write an essay on concussion and all, but then if you don't learn it in a comparative way, okay, if you don't learn it in a comparative way, like I've told you the differences, it becomes very confusing. You will not be able to recollect in the exam. Okay, so we're going to come to the management in the next session, but here it's very important. So all of you, did you understand? I need an interactive session, not a silent session. Otherwise, we would have easily recorded a video and put it for you. Okay, who all are there? Let me see. Okay, all of you are energetic and there. I'm very happy. We're going to have lots of live sessions this year. Okay, I want to majorly take all the sessions as much as possible as live sessions this year, unlike previously the recording, because I want to interact with you. Because yeah, we have a target 250. Okay, target 250, where Dr. Shifali and all will be guiding you all very soon after our AIMS exam, isn't it, Dr. Shifali? Okay, where we'll be having a team of our toppers, which will be as a part of our academics team to help you all, okay, in a way possible. Okay, so fine. Where is Dr. Shifali? Okay, fine. So yes, yeah, thank you, Dr. Shwar. Yes, we're going to create a new batch, a 250 elite batch, 250 students in an elite batch, where we want at least 50 government college admissions. This is our target, 50 government college admissions in the coming year. And like we used to have 3, 4, 5 like that, 50. And this is purely being selected on a merit basis. Okay, the students will be purely selected on a merit basis based on their dedication and commitment. How much you're attending the live session, how much good you're scoring in your exams, okay, how much consistent you are. So our toppers will be a better person to judge you all how good, and you can learn from their experiences. That is majorly they will play the role in. Okay, you will learn from their experiences, and definitely I'll be guiding you, but then you learn from everyone's experience, how they experience, how was their face, what was it like uh, when it was no, what is it, May, what was it like when you were learning in May, month of May, how is it like? Okay, how pressurized it. Now, I could see some students are too much stressed at this moment, worrying too much on everything, too much getting involved in the controversial questions. Okay, thinking that what if this question comes? It's too early. It's too early, isn't it, Dr. Shefali? What is there was one more person who used to be there. Who is that? Sapna Suresh is not there today, I think. Yeah, fine. And even yeah. Anyway, so yeah, that is our plan. The light batch. Let's continue. Okay. Now, yeah, this is as I was saying you, this Ellis and Davy fracture. Okay, Ellis and Davy classification. In fact, our fractures is the most important part in your periodontics because every exam has it. Okay, so basically, this is the diagrammatic representation, and they say that there are 9 classes. So that in itself is a question: how many classes are there in your Ellis and Davy classification of fracture? 9. Okay, 9 classes are there. Now, one thing I've noticed is the last few years, I've not seen any other classification being asked other than Ellis and Davy classification. So let's understand. Okay, let's understand this fracture very clearly. I think I'll use blue, which will be more contrasting. Now, L is class 1 to class 9. So till 8 is seen here. Okay, and 9 is basically deciduous. So 1 to 8 is permanent tooth. Okay, permanent tooth fracture. And the class 1 is only involving the enamel. Okay, I'll give you some tricks to learn it. Simple 1, 2, 3, enamel, dentine, pulp. Very, very simple. Okay, this is involving enamel and dentine for class 2. Okay, when you have class 3, it is enamel, dentine, pulp. Now the confusion comes. Okay, now the confusion comes. What is that? Yeah, class 4 is what? Any teeth, okay, or any trauma to permanent teeth where the tooth has become non-vital. Okay, means to say class 3, even if there is a pulpal involvement, it is vital. So any non-vital teeth due to trauma is considered to be class 4. Okay, class 4. So that is where the distinction line has to be drawn. Okay, so 1, 2, 3, then it becomes non-vital. That's you forget. 4 is non-vital or 4 is root fracture. That is the confusion most of the time comes. I had it. Okay, is it non? So please note, once the pulp is involved, what is the next problem we see? Pulp is involved means pulp becomes non-vital. So closer to the involvement of pulp, the next we're going to see is non-vital teeth. Okay, now if you see class 5, you have avulsion. The tooth is out of the socket, isn't it? The tooth is lost due to trauma. Then only comes the root fracture. Please note. Okay, root fracture with or without crown fracture. So we studied previously crown root fracture and root fracture. So here they are not discussing this separately, crown root and root. They're saying that there is a root fracture with or without crown fracture, you are not bothered. There will be crown fracture, there will not be crown fracture. What I'm more majorly concerned, Ellis said, is that I'm concerned about the root fracture. So one is after 4, the 5 is avulsion, 6 is crown root fracture. Okay, and then you have got class 7 where you've got displacement or luxation. See the gap here means the tooth is displaced. Also the gap here, the pedial space here. So the tooth is displaced. Okay, where you can call it as luxation, all types of luxation injuries. Okay, then you have got the crown fracture in massage. There is some books say that crown fracture, okay, multiple fragments of fracture all of a sudden, and then as well as at the cervical level, the fracture involves the cervical level. That's 8. Okay, fracture involving the end massive fracture of the your crown. So hope it's very clear. Okay, till 4 it's very clear. 5 is basically your avulsion has come out. Okay, then you have got a root fracture. Then yeah, you have got luxation. So little not in a very perfect order, I would rather say. Okay, I would have put a better order for this. Anyway, you have to learn this. You have to learn this. So that is about your class 1 to class 8. So as I've told you, 1, 2, 3 is very simple. 4 is your non-vital, becoming non-vital. Right away, it goes out. Then root is fractured. Then there is luxation, and finally en masse crown fracture is being there. Okay, so this is about your 1 to 8. Ninth class. Okay, class 9 is deciduous dentition involvement. Deciduous dentition. And in your new books, okay, in your new books, in your recent books, you see that this is further subdivided into division 1. Okay, this class 9 fracture, division 1 and division 2. Maybe, because they ask all the time, they ask a question on Ellis fracture. Okay, there is another Davy modification. What is that? Anyone can tell me? This is Ellis and Davy classification of fracture. There is something known as Davy modification of something. Something is here. What is that? Okay, orthodontics, you have studied Davy modification of something. Malocclusion. Okay, malocclusion, will come to that later on. So in division 1, okay, yes, someone has typed. Yeah, malocclusion, Mahavish Fatima, good. Yeah, which is a modification of which classification? Yeah, angle, Alicia Singh, good, very good. So yes, 1 second, where is the chart? Yeah, fine. So division 1 is this. Okay, the division 1 will involve crown fracture, okay, or root fracture. Okay, your crown fracture or root fracture. Either crown or root will be fractured, and this crown fracture can be with pulp or without pulp involvement. Okay, and then your division 2 has got where a case there is partial displacement of deciduous. Okay, and there is total displacement of deciduous. Two possibilities. Okay, so division 1 is crown or root fracture. So this just talking about fractures, whereas division 2 is talking about displacement. Okay, so yeah, one question for you all to answer. Tell me this. Okay, uh, so read it. So a 10-year-old boy fell from a table. Okay, and not features, it is fractures. Okay, fractures 1, 1 and 2, 1. Okay, as you can see there, shown in the image below. EPT, what is EPT? Electric pulp tester. Responds to 1, 1 and doesn't respond to 2, 1. Identify the class fracture.